Welcome to MLI sessions on pneumococcal vaccine update, simplifying schedules for primary care professionals and benefits of vaccination in older adults. My name is Sharon Wang. I'm an infectious disease physician and health officer for San Bernardino County.
Hello, I'm Dale Bratzler. I'm Dean of the Hudson College of Public Health. I'm a practicing internist. I'm a professor in the colleges of medicine and public health at the University of Oklahoma.
So here are our learning objectives. At the end of our session, you'll be able to evaluate the health burden of pneumococcal disease in older adults and its role as a vaccine preventable illness. You'll be able to incorporate the latest clinical data, including mechanisms of action, safety profile, and efficacy rates into the use of vaccines of pneumococcal disease prevention. You'll be able to apply the recommended pneumococcal vaccination administration schedule in accordance with the current guidelines and recommendations. And finally, you'll be able to implement strategies to enhance the role of patient care team members to prompt and facilitate clinician-patient conversation about pneumococcal vaccination, ensuring that older adults receive timely and appropriate vaccinations. Now, first off, let's talk about the prevalence and burden of pneumococcal disease in older adults. What is its impact annually in the U.S.? In the U.S., every year there are over 300,000 cases of pneumococcal pneumonia. Of those, there are 31,000 invasive pneumococcal disease, such as bacteremia and meningitis. And of those, there are over 150,000 hospitalization, and unfortunately, over 3,000 deaths annually secondary to pneumococcal disease. You can see the mortality rate in pneumonia is 1 in 20. In meningitis and bacteremia is 1 in 6.
I think this is incredibly important because, about 1 out of 10 patients who get pneumococcal pneumonia will become bacteremic or have meningitis, get invasive disease, and there the burden of disease is very high. The risk of death, as you've pointed out, is quite high. Also important to remember, particularly for meningitis, a lot of the patients who do develop pneumococcal meningitis also suffer long-term neurologic complications.
So not just the mortality, but the morbidity is high as well.
Very much so.
So let's look at some of the common clinical presentations. So the most common one is pneumonia. Again, sometimes in older adults, they may only present as confused or low alertness. They can have fevers, chills, cough, trouble breathing, and even chest pain. The other two common manifestations are bacteremia and meningitis. Again, meningitis, they present with stiff neck, fever, headache, photophobia, and confusion. There may be neurologic sequelae such as hearing loss as well. Dr. Bratzler, what are some other presentations that you have seen over time?
Yeah, so thankfully not too common. I've seen several patients who have presented with pneumococcal bacteremia that developed something called purpura fulminans, which is a condition associated with severe bacteremia in these patients. Some of them go on to have amputations of extremities, develop acute renal failure, end up on the ventilator for long periods of time. So again, anytime somebody gets pneumococcal bacteria in the blood, there are substantial risks for long-term and severe disease in those patients.
And one of the fun teaching point that I often go over with residents and students is the Austrian's triad. So it's actually a triad of pneumonia, meningitis, and endocarditis. So patients presenting with all three secondary to strep pneumo. So I've seen a couple Austrian triad over my career.